Hello, my name is Mackenzie Winslow, and I'm going to be presenting my grant proposal on the evidence-based practice project on the psychological effects from infertility on women. I attended St. John Fisher College in Rochester, New York, and got my Bachelor's of Science in Nursing in 2019. After graduating, I started my first nursing job at Strong Memorial Hospital in the Wilmot Cancer Center on the Blood and Bone Marrow Transplant Unit. I'm currently working at UVM's Health Network Porter Infusion Center, and I'm also enrolled in the Women's Health Nurse Practitioner program at Regis College. Some background on this evidence-based practice project is that infertility is the inability to reproduce after a full year of trying. That is a full 12 months. This is a very painful and emotional experience that women go through that negatively impacts their quality of life. The CDC stated that 6% of 15 to 44-year-old women in the United States have infertility, and that this leads to many psychological issues. Some of these psychological issues include stress, anxiety, depression, diminished self-esteem, declined sexual satisfaction, and reduced quality of life. Age-related infertility is becoming a more common issue as women are increasingly focusing on their education and their careers prior to childbearing. Women are starting at much later ages before even trying to conceive, and that is why for this project I focused on women in their early 40s. Women's fertility gradually declines with age. However, after the age of 37, infertility risks increased rapidly. It was reported in a study on infertile women that over half of the participants reported infertility was one of the most upsetting events that they have experienced in their life. The CDC also stated that more than 3 million cases of infertility occur per year in the United States. There are psychological coping mechanisms. However, women are often unaware of these. They are not told about how to cope with their diagnosis, and there's an overall lack of education and awareness. It is found that many people overestimate the reproductive lifespan, which increases their risk for age-related infertility. Some women reported that they thought if they are healthy and they feel good, that they will be able to have a child regardless. However, that's not the case. Women who are 35 years and older have more psychological changes. At least that's what's been shown in a few studies. Older women often have an increased potential for physical and medical issues, lower self-esteem, and decreased energy levels. However, there is a lack of research in this department, which is why I think this project would be a great thing to do. There are also many cultural aspects that go hand in hand with infertility, such as a belief that motherhood is an important developmental milestone, and that it's also viewed as a core aspect of a woman's identity. And in some cultures, if women don't have the ability to childbear, then they're considered lesser than. The purpose of this evidence-based practice project is to mainly address the effects from infertility on women, assess ways to lessen the emotional burden that infertility brings, assess the relationship between age and the severity of the psychological burdens to do with infertility. We're also going to analyze coping mechanisms to find which are the most effective for women during this time. We want to improve research and the awareness of infertility, and most importantly, support women. Some of the questions that will be asked are, do women in their early 40s experience a more severe psychological burden with infertility? And what measures can be utilized to reduce the psychological effects caused by infertility? There are many existing gaps to do with infertility, mainly the knowledge gaps. Women are feeling blindsided with their infertility diagnosis, and one solution that was mentioned in this study is that we can address this issue in grade school and primary care visits and health promotion programs, and find ways to inform people that infertility does in fact exist and that it is highly prevalent. We want to increase the awareness of infertility, and we can also incorporate more screening and more testing to figure out who is at high risk, and we can also help women with family planning and education about infertility. The prevalence is high, and we want to do whatever we can to reduce the chances of getting infertility and to help better prepare women. There are many misconceptions that go hand in hand with infertility, such as women think that it's easy to get pregnant. They think that if you're healthy, you'll be able to have a baby regardless and have no problems. Media often shows celebrities in their 50s and their 60s who are getting pregnant, and that leads women to think that they are not in any risk. Another thing was in a TED Talk, they were talking about how children are told first comes love, second comes marriage, then comes a baby in a baby carriage. And that automatically starts people at a young age to think that that's something that's just going to automatically happen, that people aren't going to have any issues. And that leads to these misconceptions. For this project, we are going to be doing a qualitative evidence-based practice project as we are focusing on women's subjective feelings, their experiences. We are going to be having women fill out demographic questionnaires, and then they're going to also be completing 2 15-minute interviews that are going to ask questions about their experiences, their thoughts, their coping mechanisms, their quality of life, and how they view infertility. We're going to be using the Iowa model of evidence-based practice, and this is because we are going to be transforming data into making changes in practice to help improve the quality of care and patient outcomes. For our sampling method, we are going to be using purposive and network sampling. Purposive data is when a researcher can consciously select the participants that are expected to fit criteria and who they think will provide rich data. And we're also going to be using network sampling. So we're going to be taking participants or women that we're in contact with and ask them if they know any other women who meet all of the inclusion criteria who also would be willing to participate. The inclusion criteria includes that you are a woman, you are between the ages of 40 and 46, and you have been struggling with infertility for over a year. All participants must complete an informed consent as well prior to participation. To gather participants, we are going to be posting flyers in primary care offices, women's clinics, infertility centers, and we're going to be allowing women to view these and then contact us if they're interested. We're also going to be asking providers who work with infertile women to hand out flyers after their appointment, but we're going to make it clear that if a woman chooses not to participate, that the care that they receive from their physician will not be altered. And same going the opposite. If they do participate, they're not going to get like more exceptional care than they already do. Clinical significance. There is high clinical significance with this topic. Infertility education is lacking. Women have reported that they felt as if they were not educated whatsoever about infertility until after their diagnosis and until it was too late. Women's quality of life is hindered. Stress negatively affects many aspects of health, such as an individual's immune system, their physical symptoms, mental health, and well-being. In a study, 72.4 participants stated that their diagnosis and treatment were both stressful, and that many cases were reported that they felt as if they were not fulfilled from their clinician in terms of having their mental health and their psychological status addressed during their appointments. They felt as if they weren't connecting well with their physicians and that they weren't getting the care that they needed. Women are often unaware of how to monitor their gynecological health. They don't know what risk factors to look out for. They don't know what signs and symptoms to look out for. And this is something that can improve with increased education. This project's also very innovative because the target population that is going to be researched is very under-researched. It involves disciplines both of nursing and psychology. It focuses on improving quality of care for women right now and finding ways to improve for the future. We want to improve the awareness of women's emotions, feelings, and thoughts. And this project will help women's voices get heard. We can't just keep looking at statistics. We need to actually dive deep and ask women how they're feeling, how they're coping, how they think we can improve our care, and how their age is related to their infertility. This is also a very easily replicated project as the criteria is all pretty clear to the reviewers. We highly recommend that this project is funded because infertile women are in much need of support. They're struggling internally. They feel like they're alone. They feel like their voices aren't always being heard. We want to enhance the awareness of infertility in hopes that we reduce the amount of cases that happen. And this could be done by just educating women that we do have a biological time clock and we can't always wait until we're completely set with our careers before childbearing. And if we do wait, we need to know what the risks are. This is a very overlooked subject. We want to provide women with infertility education. Women should not be learning about their infertility or learning about infertility until after their diagnosis. They should be learning about this throughout their entire lifespan. As soon as they're a child, when they're in grade school, at their well visits, we need to be expressing this more. Here are my references. Thank you so much. Are there any questions?